Hey guys, welcome back to Medical Coding with Blue. It is my second video of the day. Thank you guys so much for tuning in the second time today. The first topic today was about the money question, which I will probably link that video up here. Anyway, thank you guys so much for your feedback. I was getting lots of good comments. Thank you so much. So this video is going to be about when do you pick up the history of codes. So there's lots of history of codes, and it's going to depend on a few things. It's going to depend on how the provider is documenting it, what is a patient coming in for, and how is the history of whatever condition it is relevant to the visit. Okay. Sometimes the provider will word it like it is, they'll say the patient has a history of diabetes or a history of hypertension. These are chronic, lifelong conditions, okay? These things don't ever go away. So in those instances, you would not code those as history. You would code those instead as fact if it pertains to the visit, if it is somehow affecting their care, or if the provider has to decide something because of that chronic condition, okay? So there's a difference between history of and chronic conditions, and then whatever condition they're being seen for. But let's go slow at this. History of codes, when you're thinking of like history of military deployment, history of injury, history of physical self-harm, history of a pacemaker, history of a knee or joint replacement, things like that. Those kinds of codes are going to be applied when it is relevant to the encounter, okay? If the patient is coming in and let's just say they have a cold, you can put like, I'm trying to think of something that you could use with a history of and then a cold at the same time. Okay, maybe not that. Let's go with, let's go with that. The patient's coming in for a cold, and in their history, they say they have a history of military deployment. Now, what does this deployment code have to do with a cold? If the deployment was years and years ago, it's probably not relevant, right, to this encounter. The encounter is going to be more of, we're going to check this person for the flu, we're going to make sure that they don't have pneumonia, we're going to make sure they don't have strep, that kind of thing. So in that instance, history of military deployment is not going to apply. Now, if the patient comes in, right, and let's just say they were medevaced from a deployment zone like Iraq, okay, and they were medevaced in because they needed they're requiring a higher level of care, and they're being brought back stateside. In that instance, you can put whatever they're coming in for with the additional code of history of military deployment, because it is relevant to them coming back stateside because they came from a war zone. Then you can think of it something like that. If they have a joint replacement and they're coming in for, let's say they're coming in for, they have a joint replacement, history of a joint replacement. Let's just say a hip replacement. They've had both of their hips replaced. Okay? They've had both of their hips replaced before. And now they have bilateral osteoarthritis of the knee, and they are going to prep and see if they need to have surgery for this. Is the bilateral hip replacement relevant? Yes, it is. Do you have to put the history of replacement or the presence of a joint for the bilateral hip? I forget how it's worded. But basically, like if bilateral hips were replaced, then yes, you would put that in there. Why? Because the hips are going to directly affect the knees. So yes, they are going to need to know if these hips are replaced already, and then they're talking about the knees. So yes, you would put that in that instance. If they have, I'm going off the cuff on some of these, as you can tell. If they have, let's see, Let's just say they're coming in because they have a gallbladder issue. Okay, they have a gallbladder issue, they have gallstones, they're going to need to send them to surgery, but the patient has a pacemaker. Is that presence of a pacemaker relevant to this gallbladder problem that they're going to prep them for surgery? Yes, it is, because it's a pacemaker. They have to know that there's a pacemaker going on in this patient that potentially may need some surgery, invasive surgery to remove these gallstones. Yes, they're going to need to know that they have a pacemaker. So really think of it in terms of how is this history of going to apply to this patient's care, okay? And a lot of times you'll see lots of different diagnoses throughout the note. And there's going to be like hyperlipidemia, and maybe they have psoriasis, or maybe they have RA, and maybe they have hypertension and diabetes and all of these things. Look at these chronic conditions and, the history of, in terms of how is it relating to this care? Is the provider addressing it? Is it going to affect their medical decision making? Are they having to run labs to make sure, like with diabetes and stuff like that? That's where you're going to really concentrate on picking up additional diagnoses that are maybe not in the assessment and plan. If they have a history of tobacco use, okay? So a patient comes in and they have COPD, right? But they were a smoker 50 years ago, they haven't been smoking in 50 years. Is that history of, but before then, they were a heavy smoker for 10 years. Is that history of tobacco use applicable to this COPD patient? Yes, it is. If you look in the book, it'll tell you record any history of. So if you see in their past medical history that they have former tobacco use, right, then you're going to pick up that code because it is relevant to a patient who has COPD. And I'm sure there's different factors as to why, but it is important. It is relevant. Tobacco use is very serious, and history of tobacco use is still serious because you don't know the long-term effects, or if they have like maybe a nodule on their lung or something. If they were a history of a tobacco use, then of course you're going to need to know that. It's going to need to be in the information in the diagnoses that are selected if it's documented. Okay, so that's where you can sort of pick that up and sort of try to work that out. But all of the diagnoses that you see listed in that encounter are not always all going to be picked up, okay? You need to pick up things that are relevant to the encounter, that directly impact the care of the patient, or that the provider has to consider that condition in conjunction with whatever condition they're coming in with, okay? So I hope that makes sense the way I said it, because I know I usually have these things written down, but I was running around a lot and I wanted to make sure I did this video because I did promise that I was going to do this video. So yes, that would be my advice on that one. There is a lot of history of codes, and some are necessary, some are not so necessary. And sometimes you may work in a facility where they have you pick up any sort of history of code because they're gathering statistical information. Okay, so that's another thing to ask, especially ask your lead, ask your supervisor if there are any codes like that. There's many different reasons why. Sometimes it has to do with funding. Sometimes it has to do with maybe they're running a report or something like that. It could be any number of things. But whatever is relevant, always remember that. It has to have relevance in conjunction with their treatment, okay? So not everything that is being picked up, not all the diagnoses that are being picked up have to be like individually addressed, but if it is in the note and it impacts the care of the patient, then that's when you should consider picking those things up. like joint replacements and all of those Z codes. Look at those Z codes, get familiar with them, and really look at the things that are, what is possibly related to this, and talk about it with your provider, and help them to know that there are codes out there that if this impacts this patient, like say for instance, going back to the mental health quizzes that we had, if there is a history of self-harm, there may be a need to pick that diagnosis up as well. If a patient is chronically depressed, but they have a history of self-harm, these things have a way of recurring. So maybe the provider wants that diagnosis picked up. Ask them, make sure, because sometimes depression can be under control and the patient has no symptoms, but they still have those tendencies. So again, history of self-harm, sometimes they do cutting and sometimes they don't. So it all depends. So you really want to take a look at those history of codes. That way you can make sure that you familiarize yourself so that when you're looking through the documentation, you can spot it if it's in there. Okay, sometimes coders don't always know that there's codes for certain things. So this is why getting familiar with the history of codes is also important. It's very important to do that. You're not diagnosing the patient when you're looking through the encounter. And of course, I'm strictly talking about the outpatient setting. Inpatient has different rules. They do things differently. So I will eventually get into those videos, but just not right now. Right now is all about outpatient. Okay, so when you are looking at the encounter, look at all the relevant information. Okay, if you don't think that it's relevant, really look and make sure to just clarify that that's not going to impact the coding. Okay, so I hope you all enjoyed this. I hope this was good, at least informative for you. When it comes to diagnosis, selection, things like that, it is going to take time. It is a lot, but after a while, when you keep doing more cases and things, it will get easier. You will get sharper as you start to develop more as a medical coder. So never fear there. But thank you so much for your questions, and I hope you guys keep them coming. And also, Q&A Tuesday is going to be shaping up to be very nice because I did get a good group of questions today. So I'm already stockpiling for next week. So, but let me know. I will be back tomorrow for Quiz Friday. We'll be ready for that one. So anyway, but I hope if you've been watching this whole time, I hope that you've already hit that like button. And if you've subscribed, thank you so much. If you haven't subscribed, please subscribe because it really does help me with the ratings and it does help me to move up. So anyway, I hope you've all enjoyed this, and if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all on the next episode. Bye!